I am Ramani, Professor, Department of Fundamentals of Nursing. I am working in Sri Balaji College of Nursing. Post name Nursing Foundation. Post code 603. Topic position. Today we discuss about the definition of position. Positioning is defined as planning the person in a proper body alignment for the purpose of preventive, promotive, curative, and rehabilitative aspect of health or placing the patient in good body alignments as needed therapeutically. Definition of positioning is defined as planning the person in a proper body alignment for the purpose of prevention and promote and cure and rehabilitate the aspect of health, that is called as an positioning. Once again, I repeat the positioning definition. It is defined as planning the person in a proper body alignment for the purpose of preventive, promotive, curative, and rehabilitative aspect of health or placing the patient in good body alignments as needed therapeutically. Second one, purpose. Purpose of position. To promote comfort to the patient, to prevent complications caused by immobility, to stimulate circulation, to promote normal physical function, to promote comfort to the patient, to provide proper body alignment, to promote normal physical functions. That is, these are all the things is here, purpose of positioning. First one, to promote comfort to the patients. That means if you are giving the supine position, that is more comfortable, means that is the patient is feel more comfort. And second one, to prevent the complications caused by immobility. That is, to prevent the complications, the patient is immobilize the part. For example, fracture is take place. What will happen? You can give the comfortable supining or sidelining or left lateral like that. You can give to the patient. What will happen? Complications also prevented as well as the comfort to the patients also. And to stimulate the circulation. What will happen if the placing the patient in a one position? What will happen? The circulation is affected, so change the position according to the disease condition of the patient. Third, fourth one, to promote normal physiological functions to the patient. And last, fifth one, to promote comfort to the patient, to provide proper body alignment and proper normal physiological functions to the patients. What are the things? Once again, we discuss: promote comfort and prevent complication, stimulate the circulation and promote the physiological function, promote comfort and proper body alignment, promote normal physiological function. These are all the purpose of the positioning. Next, we see about the principles of positioning. First, we read out: maintain the good body mechanics. Another one is wash hands before and after procedure. A third one, ensure patient's comfort. Fourth one, follow safety measures to prevent accident. Follow the systematic and orderly way of doing. Use right technique at right time. These are all the principles of positioning. Once again, we discuss good body mechanism. That means you can provide the proper alignment of the patient. That means give a proper positioning of the patient. That is in a good body mechanics. And we wash the hand to the patients before and as well as the after. Ensure the patient's comfort to the patients and follow the safety measures and systematic order and use the right techniques and the right time. Next thing is articles: clean, dry, firm, wet, different types of mattresses, bed boards, pillows, footboard, sandbags, hand rolls, trochanter rolls, bed blocks, over bed table, additional sheets, trapeze bar. These are all the articles of the positioning. Once again, I repeat: clean, dry, firm bed, different types of mattress, bed boards, pillow, footboard, sandbags, hand roll, rocanda rolls, bed blocks, overhead table, additional sheets, trapeze bars. These are all the things is a comfort devices to the patient. Through this way, you can provide comfort position to the patient. Next, we move for the position used for the comfort. What are the things? One for supine. Another one is Sims, prone, knee chest, dorsal recommend, standing, lithotomy, squatting, and sitting. That is supine. The patient lie down on the bed without the pillow. The two hands are rest both sides of the body. So that is in a supine. Sims or the posterior view, the knee placed over the pillow. One legs is flexed, the knee placed over the pillow. Another legs are straightening. Look like as a left lateral position. The chin rest over the pillow, the one hand rest over the side of the pillow, another hand on the left side, and another one is in a prone position. The patients lying or placed or sleep over the bed in a prone way. The look like a opposite position of the supine. Then next we go for the knee chest position. In this knee chest position, the patient's face placed over the pillow. The two hands are rest both sides of the pillow. That means the right hand on the right side, left hand on the left side. And the two legs is bended, and that is and then one pillows placed under the abdomen. So this is in a knee chest position. And then the dorsal recommend position. Dorsal recommend position, the patient placed in a supine position. The head under this head, place the pillow under the head. Then the two hands, the right and left side, the two legs are separated and just as a flex the knee. That is in a dorsal recommend position. And another one is the standing position. The patient standing with the two legs, that is called as in a standing position. Sitting position. Sitting position, the patient sit over the table or the chair or the bed, that is called as in a sitting position. Another one is squatting position. The patient sitting, look like a sitting, as well as they fix the two legs, the knees are flexed, that is called as in a squatting position. And lithotomy position, look like as a delivery position. The patient places the head over the pillows. The pillows are pillows, and the two legs, the two hands are placed or keep it in the right and left side of the body, and the two legs are separated and tied over the rams or like that. That is the lithotomy position. So these are all the position used for the comfort to the patients. That is positioning. So what are the position? One for supine, another one is prone, another one is sim, and knee chest, then standing and dorsal recommend, and lithotomy, squatting and sitting. These are all the things is a position used for the comfort. Next, one by one, we discuss about the positioning. That is the supine, dorsal, horizontal recommend positioning. The patient lies flat on his legs together, as a head may be supported with a pillow and legs either slightly flexed, a small pillow under his knees, cotton ring under the pillows, air cushion, under his buttocks to prevent bed sore in bedridden patient. Footrest is used to prevent the foot drop. Supine, dorsal, horizontal, recommend position. The patient lies on his legs together. His head may be supported with a pillow and the legs either slightly flexed. A small pillow under his knees. Cotton ring under the two elbows. The air cushion under his bed to prevent the bed sore. In bedridden patient, the footrest is used to foot drop. So, in the supine position, the patients lied in a lying position. So, the head you support with the use of pillow. The legs are slightly flexed, the small pillow under the knees. So, the knees are resting and the cotton rings and air cushions are used during this supine position. What will happen to prevent the bed sore to the patient, as well as if the patient is bedridden or unconscious patient, what to do? And to use the footrest to prevent the foot drop. So far, we discussed the supine, dorsal, horizontal, recommend position. Once again, repeat. The patient lies flat on his legs together. His head may be supported with a pillow and the legs either slightly flexed. A small pillow under his knees, cotton ring under the elbows, air cushion under his buttocks. So, to prevent the bed sore in bedridden patient, footrest is used to prevent the foot drop. This is a supine or dorsal or horizontal or recommend position. Next, we move for the dorsal elevator or semi-recommend position. The patient lies in the bed with the two or more pillows which may be arranged in armchair patient to support shoulders, arms, elbows. This position used in minor respiratory distress. Once again, I tell you, dorsal elevated or semi-recommend position. The patient lies in the bed with two or more pillows which may be arranged in a armchair patient. The patient lies in the bed, two or more pillows. It may be arranged in the armchair patients. Right? The two shoulders, the support the shoulders, arms, elbows are supported. That means the patient look like as in a sitting position. The patient's head is placed over the two or three pillows. The two hands are placed in the right side and left side, two pillows. So the two hands and shoulders are rest, the arms are rest, the elbows are rest over the pillows. The position is used in a respiratory distress. This is in a dorsal elevator or semi-recommend position. Once again, I repeat, the patient lies in the bed with the two or more pillows which may be arranged in armchair patient to support shoulders, arms, elbows. This position is used in minor respiratory distress. The two things is over. So far we discussed supine and dorsal position are discussed. Third one, prone position. The patient lies on the bed in a prone position. The one pillow placed under the head. Prone patient means that is the opposite of the supine position. That is the prone position. The patient lies on the bed in a prone position. The one pillow placed under the head. The one pillow under the head, one pillow under the abdomen, two hands placed both sides of the head, one pillow under the angle. This position used for patients with burns, injuries on the back, to relieve pressure to prevent aspiration of saliva. This is used for giving enemas, suppositories, rectal examination. The patient lies on the bed in a prone position, the one pillow placed under the head, the one pillow under the abdomen, the two hands placed both sides of the head, the one pillow under the ankle. This position used for the patient are suffering by the any other burns or injuries on the back. So to relieve the pressure to prevent the aspiration of saliva, this is used for giving enemas, suppositories, and rectal examination. So this is called as a prone position. Prone position, it is opposites of the supine position. This is called as a third one. Fourth one, Fowler's position. This is more erect position. The patient sits in a upright position. This position maintained by means of backrest and additional pillows. The arm should be supported on pillows. The patient sits in a armchair patient. Air cushion under the buttocks to prevent pressure. This position is used to relieve dyspnea. Once again, I repeat, this is more erect position. The patient sit in a upright position. This position maintained by means of backrest and additional pillows. The arm should be supported on pillows. The patient sit in a armchair position. The air cushion under the buttocks prevent pressure. This position is used to relieve the dyspnea. Then another one is side lying or lateral position. The patient lies on the bed in a side lying position, one pillow under the head. One pillow gives support to the back, one pillow gives support to the arms and abdomen. One pillow between the knees take weight of the upper leg. This is used for giving enemas, suppositories, and rectal examination. Side lying or lateral position. The patient lies on the bed in a side lying position. When the patient stays in a supine, then you can change it into the, as a patient in turned, that is in a side lying position. Then one pillow placed under the head. One pillow gives support to the back. One pillow gives support to the arm and abdomen. One pillow between the knees to take the weight of the upper legs. This is used for giving enema or suppositories or the rectal examination. So this is an uses of the side lying position. So we discuss the side lying or lateral position. Next, we move for the cardiac table. So far, we discussed supine position, left lateral, Fowler's, and side lying position and cardiac position. The cardiac position, place the table over the bed in front with the pillow on it. Place a table over the bed in front with the pillow on it, on which the patients can lean forward and take rest. Patient as an air cushion to sit on and a small pillow under the knees. This is used for cardiac patients to relieve the fatigue and to prevent the embolism. So this is called as a cardiac position. Place the table over the bed in front with the pillow on it. So the table placed in the actually the table is to keep it in the placed or keep it in the foot end. When the patient is needed, when it is needed for the patient, immediately you can relieve the screw and immediately come to the you can track it and place it in front of the patient. Then place a pillow over the table. on which the patients can lean forward and take the rest. Then the patient is lying over the pillows, take complete rest. Sometimes the patient is sleeping also. And then the patient has an air cushion to sit in small pillow under the knees. During that time, ask the patient to sit in a cushion, air cushion, and place the one pillow under the knees to prevent the knee pain as well as the bed sore. This is used for cardiac patients. And not only why it is used when you are taking rest over the table, one thing. Another one is for heating purpose and writing. And this all the things are reading for the newspaper like that. So resting of the two hands. So this when you are watching the TV like that. So this time this is very useful for the cardiac table to the patient. This way, if the patient is the cardiac patient is used to mostly the cardiac patient is used to relieve the fatigue and to prevent the embolism. This is called as a cardiac table. Once again, I repeat, place a table over the bed in front in with the pillow on it, on which the patients can lean forward and take rest. The patient has an air cushion to sit on and a small pillow under the knees. This is used for cardiac patients to relieve the fatigue and to prevent the embolism. This is called as a cardiac position. So far, we are discussing the comfort position of the patients. Next, we move for the position used for physical examination. What are all the positions? One for supine or dorsal or horizontal or recommend position. This is called as a physical position. First one. That is a patient lies flat on his legs together. His head may be supported with a pillow and legs either slightly flexed. A small pillow under his knees, cotton ring under the elbows, air cushion under his buttocks to prevent bed sores. In bedridden patient, foot rest is used to prevent the foot drop. In supine position, the patient lie down in a supine position. The head rests on the pillow. The legs are slightly flexed. The one pillow placed under the knees to prevent the pain, and the air cushion placed under the buttocks to prevent the bed sore. The cotton ring placed under the elbows to rest the elbows and to prevent the bed sore. And if it is the unconscious or bedridden patient, the foot rest is used to prevent the foot drop. This is called as a supine position. Once again, just I read out supine position. Patient lies flat on his legs together. His head may be supported with a pillow and legs either slightly flexed, a small pillow under his knees, cotton ring under the elbows, air cushion under his buttocks to prevent bed sores. In bedridden patients, foot rest is used to prevent the foot drop. This is for first one physical examination position, that is supine position. Next, we move for the dorsal elevated or semi-recumbent position. Dorsal elevated or semi-recumbent position. One thing, that is the patient lies in the bed with two or more pillows which may be arranged in armchair patient to support shoulders, arms, elbows. This position is used in minor respiratory distress. That is called as dorsal elevated position. That means the patient lies in the bed with the two or more pillows which may be arranged in armchair patient to support the shoulders, arms, and elbow. So rest over the pillows. The position used in the minor respiratory distress. The patient look like as in a sitting position. This is called dorsal elevated position. Third one, Sims lateral or left lateral position. Sims lateral or left lateral position, the patient lies on his left side, one pillow under the head, with the left cheek resting on it. The left arm is drawn behind the back, and the right arm may be in any position comfortable for the patient's right thigh is flexed against the abdomen. This position is used for vaginal and rectal examination. Sims lateral or left lateral position. The patient lies on his left side, one pillow under the head with the left cheek resting on it. The left arm is drawn beyond the back and the right arm may be in any position comfortable for the patient. Right thigh is flexed against the abdomen. This position is used for vaginal and rectal examination. This is called as Sims lateral or left lateral position. Once again, I clearly defined the patient lies on the left side. One pillow placed under the head. The cheek rests on the pillow. Okay. The left arm is drawn beyond the back and the right arm may be in any position. The comfortable for the patient. Right thigh is flexed against the abdomen. This position is used for vaginal and rectal examination. Fourth one, erect position. This is normal standing position with both feet on the floor. In this position, the patient is examined for orthopedic and neurological procedures. That is called as an erect position. I clearly explained this is a normal standing position with both feet on the floor in this position. This is called as an standing. The patient is examined for orthopedic and neurological procedure. That is called as an erect position. Knee chest position. The patient rests on the knees and the chest. The head is turned to one side with the cheek off over the pillow. The small pillow placed under the chest. The arms are above the head. The weight should rest on the chest and knee. The knee slightly flexed. This position is used for examination of rectum and vagina. That is called as a knee chest position. Once again, I repeat, the patient rests on the knees and chest. That means the patient lying down, it looks like as a prone position, but the knees are flexed. The chest or rest over the pillow. Then the head is turned on one side. Immediately the head is turned for the one side. The cheek over the pillow. Okay. Then the small pillow placed under the chest. Then the arms are above the head. The weight should rest on the chest and knee. The arms are above the head. The both sides, the head of the two hands rest over the both sides of the head. The knees slightly flexed. The position used for the examination of rectum and vagina. When you are examining the rectum and vagina, the patient placed in a prone, look like a prone, but not a prone position. Just as the knee rests over the pillow, the chest rests on the pillow. That two hands is rest over, the head is rest over the pillow. The two hands are placed both side of the right side as well as the left side of the pillow. Then easily you can assist or examination of the rectum and vagina. This is in a knee chest position. Once again, I read out for the patient rest on the knees and the chest. The head is turned to one side with the cheek off over the pillow. This small pillow placed under the chest. The arms are above the head. The weight should rest on the chest and knee. The knee slightly flexed. This position is used for examination of the rectum and vagina. So, what are all the physical examination? One for supine, then dorsal and standing and side lying positions and knee chest position. So, these five positions are comes under the like asana physical examination. Then sixth one, that is the trendline work position. The patient lies on his back. That is like a trendline work positioning. The patient lies on his back. The foot of the bed is elevated at 45-degree angle. The head is slow in a low. The body is on an inclined plane and the legs hang downwards over the end of the table. Once again, I read out: the patient lies on his back. The foot of the bed is elevated at 45-degree angle. The head is low. The body is on an inclined plane and the legs hang downwards over the end of the table. That what is meaning? The patient lies on his back. Okay, the foot of the bed is elevated at 45-degree. The head is low. What will happen? The low level of the head and the foot end is elevated at 45-degree angle. The body is on an inclined plane. The two legs hang downwards over the end of the table. So the patient is more comfortable in this position. This neatest position is look like as an opposite opposite of the prone position. Likewise, that this Trendelenburg position also like as an supine position, but it will be a foot end is elevated at 45-degree angle. The patient lies on his back, but the head is very low. The body is on an inclined plane and the legs hang downward. Okay, over the head of the table. That is called as an trendline work position. Once again, I repeat: the patient lies on his back. The foot of the bed is elevated at 45-degree angle. The head is low. The body is on an inclined plane and the legs hang downward over the end of the table. So these positions are mostly used for the physical examinations like asana, catheterizations like that, any other perineal cares or any other delivery like that. This is used for episiotomy. Like that, the periods also the tunnel position is used for this are all the things. So in that physical examinations, we discussed one for the supine position and prone position, dorsal position, and left laterals or side lying position, and a knee chest position and trendline position. So this all the things comes under the physical examination procedure. And seventh one, lithotomy position. The patients lie on his back with one pillow under the head. The legs are well separated and thighs are well flexed on abdomen and legs on the thighs. The patient's buttocks brought to the extreme edge of the table and legs are supported on the strips. If the calf muscles are pressed or if a position is prolonged, there is danger of embolism. This is used for gynecological examination. Once again, I repeat: lithotomy position. The patient lies on his back with one pillow under the head. The legs are well separated and thighs are well flexed on abdomen and legs on the thigh. The patient buttocks brought to the extreme edge of the table and legs are supported on the strips. If the calf muscles are pressed or if position is prolonged, there is danger of embolism. This is used for gynecological examination. This is called as an